Hey guys, Dr. Stephanie here, and today we're going to work on a little bit of hip mobility and a little bit of hip strengthening. Both hip mobility and strengthening kind of go hand in hand. You can't really have one without the other. And it's important that you do both because if your hips move well and your hips are strong, then you won't have any issues with injuries. I mean, obviously you can still get injured, but it's much less likely, especially from just doing daily activities, and you'll just feel better overall. You'll also sleep better because I find that if your hips are stiff, your back is stiff, it's hard to sleep comfortably, or you wake up in the morning, you're really stiff. So working on hip strength and mobility will help decrease the risk of injury, will help you feel better, will help decrease any pain that you currently have, and it'll just make you feel better overall and make you function better during the day. So all you need for this is one loop resistance band. A lot of these exercises we'll do without the band, but we are going to use the band for a few. So we're going to start off on our back. And feet are going to be pretty wide here because what we're going to start with is just rotating side to side here. Just nice and slow. And you can just follow along with me as we do this routine. So nice and slow, getting those knees as close to the floor as you can. Just back and forth. And if you can't go that far, that's okay. You have to start somewhere. So even if it's just a little movement, just do that little movement and gradually work up to increasing the movement. So just go back and forth as far as you can comfortably. And it's okay for your back to come up off the mat. Obviously, you don't want to turn a ton and you want to kind of keep your shoulders on the mat. But you can lift that back up a little bit. So just back and forth here. Back and forth. As far as you can comfortably. Just do a couple more. And then from here, we're going to take our feet and put them together. And we're just going to let our knees fall out to the side. And you can just kind of slightly rock back and forth here. Just kind of opening those hips, working on those adductors, those groin muscles. Those tend to get tight. And if those are tight, that can cause pain in your pelvic floor area, in your low back. It can make you more at risk for injuries to these muscles in here. So it's important that you stretch those out. So just kind of gently rock. Shouldn't be a big movement. But just let those muscles relax. Back and forth a little bit. And if you don't want to rock, you can just sit here and let them just hang out. Let gravity kind of pull your knees towards the floor. And then from there, we're going to go up into a bridge. So we're going to do this frog bridge. So you're just going to lift your hips up and then back down. And we'll do about 10 of these. So that was 1. So we'll go 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, from there, we're just going to cross our leg over here, and we're just going to kind of pull it to the side and then back up. So we're just going to go towards that side where the knee is up, and then back up. Just go down as far as you can comfortably, kind of letting that foot pull the knee down towards the ground. Pull that knee down, back up, pull down. And it's okay to let your back kind of twist. This is working on hip mobility, but this is also working on kind of lower back, lumbar mobility as well. Let that foot, pull that knee down, and if you want to pause for a couple seconds here, you can. Like that. Okay, we'll do one more here. And then from here, we're going to stay on this leg, and we're just going to lift this foot up off the ground as far as you can, and then back down. So this is working on some mobility, but also strength. So this is good for hip flexor strength in this left leg. So let's do 10 of those. We'll see, that's 1, 2, 3, 4, 5, 6, 7, 8, 9, and last one, 10. All right, now let's switch legs. And so now we're going to pull this knee down towards the floor, this left knee, and back up. Go as far as you can comfortably. Letting that foot pull that knee down to the ground. Trying to really control it as well. So you don't want it to just fall. You don't want to just rotate your whole body. You just really want to control it down. It's nice and slow. And let's do one more. Okay, then from here, we're going to keep this leg up here. We're just going to lift this foot. We'll do 10 times. So go 2, 3, 4, 5, 6, 7, 8, 9, and last one, 10. Okay, now we're going to grab our band here and place this band around our feet. And again, lie back down on your back on the mat, and then feet up in this position. What we're going to do is just straighten one leg and then straighten the other leg. If you find this way is too hard, you can start with your legs on the ground and just bend one knee and then bend the other knee. Okay, so we're going to do just about 10 of these. So we'll call that 1, 2, 3, 4, 5, 6, 7, 8, 9, and last one, 10. Okay, now we're going to go ahead and place this band around our ankles and then go onto our stomach. And from here, you're just going to lie on your stomach and you're going to do a hip internal rotation. You're just going to rotate your feet out and back in just as far as you can comfortably. Really going slow on the way back in because you don't want it to pull you together. Do a couple more here. Just pulling apart as far as you can comfortably. And then coming back together slowly. Okay. Let's take that band off. And then we're going to stay on our stomach. And from here, we're just going to do kind of a circle. So you're going to bend your knees as far as you can, and then rotate your feet around. So just rotate in this circle here, going all the way down to the floor. Make it as big of a circle as you can. Really working on bending those knees as far as you can, and then getting them out to the side as far as you can. Big circles here. Let's do 2 more. 1, and last 1, 2. All right, we're going to finish by sitting. And what we're going to do is just a 90-90 rotation with a little bit of lean forward. So what you're going to do is sit with your knees and hips bent to 90 degrees. Just bend forward as far as you can comfortably. You want to make sure your back is straight so you're not hunching forward like this. You're leaning forward at the hips as far as you can comfortably. And then rotate, and same thing this direction. And rotate back. So you just hold for a couple seconds here. And then rotate back to the other side. And back. I'm going to do a couple of these. And you can hold these for longer if you need to or want to. Lean forward. And lean forward. Let's make this the last one. All right, so now your hips should feel a little bit stronger, a little bit more mobile. Try doing this multiple times a week. Just stay consistent at working on your hip strength and hip mobility, and eventually you'll notice a big difference.